Good day. Many of you who know me professionally know me from my traditional organization development work and my early work in personal growth in the industry. And some of you also know me in my nonprofit pro bono side of my life as a global goodwill ambassador, which I was motivated to cooperate with the team with that organization because all of us despise injustice. So as a community activist, I'm always triggered by injustices, but always look towards solution as well. So with that, I will introduce Bob Hilke, who's had 31 years with United Health Group, and it's Bob Hilke, a premier alignment consultant. Bob, take it away.
Well, thank you, Frank. It's always a pleasure to meet with you, and I love all the initiatives you're doing to help make the world a better place.
Thank you.
Yeah, and so I'm pleased to be here to have this discussion with you and share with your friends. And obviously, if I worked 31 years in the healthcare industry, I have a passion for trying to make the world better as well. And when I started working in my career at the nation's largest health insurance company back in the day, it seemed like we were doing a really good thing helping our members to have some cost management principles that would help them save money and get good health care. And for many years, I felt that we were doing a pretty good job with that objective. But lately, I've been telling people for a while that I felt there's going to be some haircuts in the healthcare industry. And so I just want to share some validation of that. I'm going to share this slide. Hopefully you can see this now. This is the stock history of United Health Group from day one up till today. Well, actually several weeks ago. And I was really surprised when I saw the crash, but then also like I said, I'd been telling people, expect some haircuts here because I have felt for a long time that the healthcare industry is overpriced. I think it's everyone's pain point, whether you're an employee or an HR executive or a CEO or a CFO. I think everybody agrees it's overpriced. Mm-hmm. But to lose actually over half the shareholder value in the stock in about a year's time, I think that's a big signal that there's bumpy roads ahead in the industry. And with United Health Group being the largest insurer, I think there's also going to be some other implications in the sector, not just at United Healthcare, but some of the drivers of United Health Group's stock loss or price loss have been rising medical costs and reduced government reimbursements because they do a lot of government business, and regulatory and political uncertainty, and also some leadership changes, including, by the way, something very unfortunate, the loss of their CEO at United Healthcare with a terrible tragedy in New York that probably most people know about. And that kind of shook up the space a bit. There's a lot of dissatisfaction, and I think that rose some of those feelings to the surface a bit around the industry. And so there's a lot of things that could speak to why this happened. But the reason that I'm sharing this is because I truly believe that this is not the first that we're going to see in the sector. And the reason is they're just overpriced. And the reason that I can say that confidently is because the gentleman I'm going to introduce in a moment, Daryl Moon, is actually helping companies cut the cost of the healthcare in half of traditional healthcare. And if we can do that, which we're doing at Premier Alignment Consulting, if we can come in as consultants and advise companies on how to shop differently, how to implement some strategies that companies don't find on their own, but with industry insiders like our Premier Alignment Consulting company is, we can help them implement strategies that make healthcare better, with better outcomes. Employees love it, so it's attractive for employees, oftentimes resulting in almost free or even free healthcare with no premiums, deductibles, or copays. That's possible. And so CEOs would certainly look at that as being a wonderful opportunity to attract and retain top talent. And if we can do that, and while at the same time cut the cost that the company is paying for their healthcare benefits in half of the cost of traditional healthcare, it's like the big healthcare companies, they don't have a sustainable model anymore. And so I think there's going to be a lot of disruption in this sector in the years to come. And one of the drivers for that is Daryl Moon and his consulting and the principles that we're teaching people. And even for free on our website, we put out there the principles that will help companies accomplish what I just spoke about. And so I just want to also point out that during my tenure at United Health Group, I had a lot of different responsibilities there. One of the responsibilities I had was the business owner of the company's appeals database. And so I can tell you, in dealing with thousands and thousands of appeals, which are the worst of the worst experiences health insurance customers have, I have a real feeling for the issues that people experience. And I can truly say that I think healthcare is the biggest pain point that people have in their lives. They're frustrated with dealing with healthcare claims, not getting claims paid, going through appeals processes. The companies probably look at it as being a pain point because they deal with employees that have issues. And if you're a provider, it's a pain point, and that's why a lot of really good doctors, for example, are actually leaving the traditional model of healthcare because they don't want to spend half their time trying to get paid by the insurance companies. And so there's just a lot of frustration, a lot of pain points in the healthcare world today that everybody's familiar with, but it's like, well, what's the solution? And that's why I would like to introduce Daryl Moon, because he has brought the solution and is prepared to help companies implement this solution and experience a really great experience with healthcare if they will implement the advice that Daryl brings to the industry.
Thank you, Bob. It's truly an honor to participate in this discussion today with both you, Bob, and Frank, and others that are on the line. I'm truly honored. Thank you very much. The best first comment I can say is that healthcare has been hacked, and I didn't hack it. It's actually been hacked by a major organization. I just simply communicate that it's been hacked. I'll tell you that my background is I used to run hospitals, 10 different hospitals all over the country, most of those being the largest hospital system in the country, Hospital Corporation of America. And the reason I left the treatment side of healthcare was I was so frustrated with the fact that here I am at the top of the food chain where most of the money is spent, and yet I don't work for my customer. Why is it that this largest industry in America can get away with those at the top of the food chain literally being bonused and incentivized and encouraged to scheme and work against their customer? Like, that doesn't make any sense. My goal was to fill up my hospital beds. My goal was to increase revenues and profitability of the hospital. And yet, there's not a business leader in America who is a large purchaser, other than Uncle Sam, in purchasing healthcare for their employees. Now, tell me one business leader that loves the idea that the vendor is spending all their time scheming against them and feeling no accountability to the customer. It's just not right. And so I left the treatment side of healthcare to try to be a part of a solution or try to bring solutions to the table, because I truly believe that no one can fix this problem better and easier than those who purchase it. And the sad thing is, as I've studied this industry and found lots of opportunities for improvement, I would say the biggest opportunity for improvement is that business leaders feel they have no control. When in fact, the truth is they have all the control. It's just that the healthcare industry has pulled the wool over their eyes to the point that they just think they have to put up with it. And yet the very principles that they apply with every other part of their business, Business 101, will apply to healthcare. It's just that nobody's shown them that you can do it. And so I love to tell anybody and everybody that healthcare is just another purchase. And you can manage it just like you do all the other purchases. And you get to decide, you're the buyer. And so we're going to talk about some of those principles today. But let me tell you a little bit about why I'm so passionate about sharing that healthcare has been hacked and how healthcare was hacked and how employers now can implement a similar hack to get what Bob talked about, which is better healthcare at half the price. So a very large organization of 70,000 lives had the opportunity to create a brand new healthcare system about 30 years ago and did something nobody else has ever done before. They went out to their customer, just like Edwards Deming, the grandfather of the Net Promoter Score, the Google 5-star rating, total quality management, Kaizen, Six Sigma, all those different, the ways we run business today. He says, define your customer and find out what's going to delight them. First things you do. And they went out to their customers and said, what do you want from healthcare? Well, that's not the way healthcare is built. Healthcare is built by people going to school who study this amazing, most miraculous organism in the universe, the body, and they specialize in an area, and then they put up a shingle and say, hey, come be the benefactor of my great wisdom, and I'll help that with that particular area of your body. It's like, no, what if you really build healthcare from the ground up by asking the customer what they want? And what this organization found out was what the customer truly wants is healthcare to be a guest at their table, to be a partner on their journey through life. Because the very best definition of health, as I ask people all over the country, is, and I hear this all the time, is just being able to do the things I want to do, not letting my health get in the way. And what if healthcare was truly a guest at your table, a partner on your journey, supporting you in reaching life's dreams, life's aspirations, life's goals? And that was the primary purpose of healthcare, was to not just fix you when you're broken, but actually support you in reaching your dreams. And then build a trusting relationship in such a way that when you did get sick or when you had a problem, you knew you could confide, you knew you could trust, you knew you could have quick access to immediate health care that really was coordinated at every level. And that's what the customer said that they wanted. And this organization, after 30 years, by building healthcare around the customer, has become the shining star around the world on how to do healthcare. It's, they call it an aspirational model of healthcare. Why? Because it's about helping people reach their aspirations in life, not just about fixing sick people. And they're the only organization, they exist right in the United States. They're the only healthcare system in the US that's won the President's Malcolm Baldrige Award twice, a very prestigious quality award that it's incredibly difficult to get the first time, much less twice. And very few healthcare organizations have ever gotten it, and they received it twice. They reached the highest level of population health improvement, went from one of the worst population healths in the world to now one of the top ones. They've created immense customer satisfaction, 98% customer satisfaction among 70,000 people. Go figure. And the most amazing part is that they spend half as much on healthcare. So it's like, okay, it can be done. It's been hacked. How do we learn from what they did so that employers who are purchasing healthcare can purchase that for themselves? And I would say that the number one foundation or principles of that system were, number one, first and foremost, create a relationship of trust and support people in reaching their aspirations. So what they said to the doctors, who they assigned to people as a trusting friend, was your first job was not to be a doctor. It's not. That's why you went to school, but it's not your first job. Your first job is to coach people in reaching their life's aspirations and build that trusting relationship so that when they do fall off the cliff, they can call you 24/7, get a hold of someone who's going to coordinate their care and make sure they're getting the very best appropriate care immediately every time. It's just that simple. So coaching people to support them in reaching aspirations is fundamental. And then the second thing is having a team of primary care providers who you can trust, who you know you can have immediate access to, and they're going to coordinate your care and they're going to take care of you because they know you. And then the third thing is simply accessing the best care. You might think, well, isn't the best care the most expensive care? No. The more expensive care is the care that's not very good care because of all the complications. So in healthcare, if I want the very best care, I want to go find out who has the best appropriate scores, who has the best outcome scores, who has the best customer satisfaction scores, who does the best job of that particular procedure, does a lot of them, has really good outcomes, and now I feel confident that I can go get some kind of specialty care, whether it's a dermatologist or a cardiologist or a surgery or whatever. I can go get care beyond primary care that is top quality. And by just driving people to the best quality providers, I mean, right now people go, gee, I need a carpal tunnel surgery. My cousin had carpal tunnel. I'll ask him where they went and I'll see if they had a good experience. Hey, what a wonderful way of figuring out how to have somebody cut open your wrists. Like, no. And certainly by just going into the network and going to whoever the primary care provider you might go to within a network sends you to, well, they're just going to send you in the network. That doesn't mean they have good outcomes. They're just a part of a system that's trying to drive people into hospitals to make more money. So that's not a very good way. So really what I've talked about are the three fundamental steps that any employer can implement to have drastic improvement in the benefits that they offer. Coach people to keep them healthy in the first place and to be a trusting partner on their life's journey to their aspirations. It also creates enormous loyalty for the employer. Provide them access to a primary care provider, not paid on a every time they do something, but on a subscription basis, where they're actually getting paid to keep you healthy. The more healthy they keep you, the less work they have to do. So it's about aligning primary care and a team of primary care providers to keep people healthy. And then when you need secondary care, simply go to the places that do the best job. It's that simple. It really is that simple. And it's been proven by the best healthcare system in the world. Now, I'm going to stop there and see if Bob or anybody else has a question before I kind of jump into how you do it.
How do you address the natural resistance to change that people have?
Well, that really is one of the biggest challenges, is that people are comfortable doing what they do, even if it's not good for them. And so one of the things that we start with an employer is, you're the customer, define what you want. What's going to delight you? And so in most cases, employers want to offer healthcare benefits to create loyalty, attract and retain top talent. It's number one thing. They also want a healthy, productive workforce, and they don't want it to cost a lot of money, but define what you want and then measure to see if you're getting it. It's not hard to send a survey out to all your employees to say, hey, how effective is our health benefits plan by recruiting you to come to work here? They might find not. I can go get that anywhere I go. There's no big deal. And then how effective is it at retaining people? Are you staying here because of that? Probably in most cases, not. And so find out a benchmark. And while you're surveying to get that benchmark to show improvement afterwards, simply ask, who do you trust? Who do you feel within the company has your back? Find the group within the company that holds the trust capital of the employee population at large. They will become an incredibly important team as you work through change, and let them be a part of that change, and they will be your best communicators to then share with the rest of the employee workforce what changes are available. And one of the principles that we hold dear to is that give people choice. Don't make them change. Give them tremendous incentives to change and have something better for themselves, but never take away the choice to not keep what they have. You'll find over time that with those incentives and with the outcomes of something better, people will migrate to something better. But it's hard to say to everybody, I figured out what's better for you. I want you to change. Here's what you have. It's just a very difficult, stress, anxiety creating principle. So just getting the people who are in possession of the trust capital within the company and having them be a part of it so they can understand why the change is being made and then they can communicate it and support it is huge.
Thank you.
So, Daryl, when I hear you talk about the aspirational healthcare model, I hear you say things like, who are you caring about? Who are you catering to? And I think that's where the healthcare industry has gone wrong. Because when I was getting involved in it, 30 some years ago, I felt like we were focusing on catering to the members, helping them get affordable access to really good healthcare. And over the years, it became more and more a focus on catering to the shareholders, the stockholders. And if you're a healthcare company, you should be catering to your members and not so much for Wall Street. And I'm afraid that that's where they've built a foundation on the wrong, or they've built their business on the wrong foundation. And the members are paying the price.
Right.
And now the shareholders are paying the price because the members were not the focus as much as they should be. And that's where this aspirational healthcare model, like you say, from the ground up, talk to the people, find out what they need, and serve them.
Well, and the fact that no one's been holding those healthcare companies accountable, whether it be the providers or the health insurance companies, it's gone awry. And just to put a little bit of a cherry on top of how big of a problem this is, the healthcare industry in America is over $5 trillion. Now, that's pretty hard to wrap your head around how big that is. Well, that's almost 20% of our GDP. Now, let's put this in perspective. Only 40 years ago, the healthcare industry in America represented about 8% of our GDP, and manufacturing represented 20%. And in 40 short years, we have transitioned from being a country of manufacturers that build things into a country of healthcare. 8% manufacturing now, almost 20% healthcare. That's not a good transition. That's not a productive transition. And the money we spend in healthcare, that $5 trillion, we now know because of better models that half of that is waste. Well, how big is that waste? Well, that waste is bigger than the entire gross domestic product of Russia. We waste every year in America the entire GDP of Russia.
Jeez.
It really is amazing. And of course, every year, our members, our employees are rewarded with a 5% increase, 8%, 10% increase to thank us for participating in their...
When they should be going down.
Exactly.
So, you talked about the insurance companies and them being healthcare, but let's talk a little bit about healthcare systems, hospital systems.
Mm-hmm.
There's a really dark secret that healthcare systems don't want to talk about. They'll want to talk about the fact that they've integrated healthcare. They've got primary care and specialty care and hospital care and wonderful integration. Well, the truth is that most healthcare systems are for-profit, and most healthcare systems purchase primary care not because it makes them money. And they buy specialty care practices, not because it makes them money, but they're the funnel source into surgical centers, imaging centers, hospitals, where lots of money's made. So when you roll out to your employees a network, no matter where you are in the country, whether it's the Cigna network, the United network, the Aetna network, or any local network, in most cases, that primary care provider that your in-network provider that most people are going to turn to, their practice is designed to fill hospital beds in many cases. By the overall structure of the design, it's the healthcare system's goal that they funnel people into their specialists, then they funnel people into their hospitals. And you might say, well, what does that look like? Well, what that looks like is I'm going to make sure as a healthcare system that because I'm paying your salary, that you're being held to a certain number of relative value units every day. As a primary care provider, you have to see so many patients, prescribe so many scripts, do so many tests in order to meet your RVUs. Well, that's by design. I don't want you taking a lot of time with each patient to figure out the real root of the problem. I want you to have just enough time to write a script or send a referral, when that is exactly the wrong approach to healthcare. What this best healthcare system in the world figured out was that by building a relationship-based, trusting, customer-centric, massively powerful primary care system that actually partners with people as their guest at their table, and then offering tremendous amount of resources and time to figure out what the real problem is, and then get people on a path of correction that makes sense, was the key. So you might say, well, how does an employer go out and create a healthcare system that looks like that? They don't have to. The good news is that for over 20 years, primary care providers have become very frustrated with these relative value unit expectations. And they've said, I'm just going to go off on my own. And I'm going to create a subscription-based, advanced, direct primary care practice that's going to take a lot more time with every patient, find the real root problem, and be incented to keep them healthy. And so they built these practices by saying to their 4,000 current patients, look, I'm going off on my own. I'm leaving the network. And if you want to stay with me, you're going to have to pay me $80, $100 a month. And you're never going to have to pay anything else for primary care. No copays, no deductibles, and I will be accessible to you by phone, anytime. Most of primary care can be done through phone, and I'm going to spend a lot more time with you to really figure out what the problem is. Well, that network now of primary care providers that are independent, not owned by the healthcare networks, which is key. Because by connecting primary care with those networks is like the dragon. You're literally feeding the belly of the dragon. So cut off the head of the dragon, send your people, incentivize your people, create incredible financial incentives for your people to go access a much better concierge level of primary care, paid for on a subscription basis, who has absolutely no ownership or tie to filling up the beast, the belly of the beast. Now, when someone needs services beyond primary care, you provide concierge level nurse navigation who have access to appropriateness scores for every provider in the country, outcome scores, surgical cleanliness scores for the hospital surgeries, all the things that we would want as we're going out to have somebody cut on us or give us, cancer medications. Send us to the best, the ones who do it the very best. And by simply coaching people to stay healthy and building a trusted relationship, offering your people the option to go to a concierge level, paid by a subscription primary care provider, and then nurse navigation to send people to the, and you might say, well, but what if you sent them to the best, but they're not in the network? Are they going to take you? Well, I got another secret to tell you. Most hospitals love cash, and they love cash up front. I would estimate that of the hospitals that I've run, close to 50% of everything we spend in the hospital had to do with getting paid. So you offer me cash up front or cash on the spot, I am very motivated to do that procedure. Even if you're not in a contract with me, you pay me up front, I'm all ears. So by accessing the best providers on a cash pay basis, employers can offer a health plan that gets them the very best care, the very, very best loyalty amongst their employees, and they can spend about half as much on total health care. That's a pretty good play. That's a pretty good direction to go in.
Hey, Daryl, I can share a personal experience.
Sure.
I am one of those that's on the subscription for primary and preventative care. And a year and a half ago, I had a mountain bike accident in a parking lot. And somehow I managed to get home, but just barely. I was in no condition at all to get in the car and drive to the emergency room or urgent care or to the doctor. But because I had this subscription-based primary care, I was able to quickly get on my computer, have a virtual meeting, and I showed my thumb, virtually, that I thought might be broken. The doctor agreed. Actually sent an x-ray machine with a technician to my house that day to take an x-ray, and it was broken. I didn't have to leave. And the other thing that the doctor was able to tell me how to care for all my other wounds, which there were plenty of. And so I could stay at home and recuperate at home. And then the x-ray came, and all the treatment that day, there was no out of pocket because it was subscription. And the PT was no out of pocket. It was part of the subscription. My wife had lab work done a couple weeks after that. They came to our house to draw the lab work. no out of pocket. And then my wife was sick a couple of months later, and the doctor came to our house. So, I mean, that's the type of service that you just spoke about, and I've experienced that. And I hate going and sitting in the doctor's office at the doctor's office where people are coughing. And imagine bringing kids to have one of your kids see the doctor and bringing the family there in the waiting room and get exposed to everyone else. When you can get this wonderful service available virtually at your home and no out of pocket because you have a very low cost subscription. And I love that about it.
Wow.
Well, and not to even mention the fact that many prescriptions are included in that, correct?
Yeah. Yep. Yeah, over 500 common prescriptions.
Yeah. So
Right.
healthcare can look a whole lot different than we currently think it does. and truly by just adding those principles, Frank.
Yes, let's talk about the money. My friend Russell called me the other day and says he's got a serious back operation coming up, and he doesn't know how to budget for it because they said you get the estimate after the operation. What's up with that? I don't go to a restaurant and eat as much as I want and then say how much did that cost. And what's happening with the pricing disparity?
So fortunately, the government has actually passed some price transparency laws that require hospitals to put their charge master or fee schedule online and make it available to the public, because the government has basically said every American has the right to know the cost of healthcare before they get treatment. They've also said to every American, you have the HIPAA right not to tell your provider that you have insurance. Many times you'll get the best price by not telling the provider you have an insurance policy. Because as soon as you say, I'm on Aetna, they have a gag order where they have to conform to the contract that they've signed with Aetna and charge you the price that Aetna's. And now that everyone can go to any hospital website because it's required by law to find out what their charge master is, and you start looking at the discounts for every single procedure across every single contract, the variance is enormous. I mean, you can't imagine how significant the variance in cost is. Just not I'm talking appropriateness or outcomes, just cost. How one contract will get a 10% discount off of gross charges, which absolutely are not connected to the cost of the care at all. And another one will have an 85% discount. In fact, sometimes within the very same Aetna, with different network contracts within Aetna or Cigna or United, the variance is enormous. And so one of the very best ways to access the best price of healthcare is not to tell anybody you have insurance and just simply go, look, I'm willing to pay cash up front and find out what they're willing to give you in the way of a price. Now, they may not put on their like I had an ankle surgery a few years ago, and on their website it showed that their gross charges was the same as their cash price. And I went in and I said, I'm willing to pay cash up front. How much are you willing to bundle all the anesthesia, all the specialists, all the radiology, everything into one price so that I know when I'm going in, what I'm going to pay for? The discount was like 80% off the gross charges.
Wow.
It was like hospitals love cash and they're willing to negotiate on a cash pay basis. In fact, some employers are rolling out health plans. Get this. They give everybody an insurance card with like the Aetna logo on it, so that when they take it home, their spouse goes, "Oh, good, I have a health insurance program." And then they say, "Put that in your dresser drawer and never take it out and never tell anybody you have insurance." What? Yeah, because I'm going to give you a company credit card, and I'm going to say, "Go buy healthcare with my company credit card." And you don't need to tell them it's a company credit card. Just simply go, "Look, I'm paying for healthcare on a cash basis." Don't tell them you have insurance. Just go buy it with cash, and it's my money you're spending. They'll often put $400 or $500 on the card. It's a debit card. And then they'll say, for specialty visits, primary care visits, urgent care visits, just go pay cash and get the cash price. But if it's going to be something more significant, then they get their mediator involved, their nurse navigation system or their contract involved that simply negotiates with the provider up front. And then when they've negotiated what that $20,000, $100,000 is, they just put that money on the card, and it can only be used for that one particular vendor, and they pay for it on a cash pay basis. And employers are saving enormous amounts of money by going around everybody thinks, well, I have to go be a part of an insurance company that has a network that's gone out and contracted with all these providers for a discount price. Baloney. That used to be the case. Now it's hurting you. It's like it's the worst thing you can do is to go buy an insurance plan where the insurance company is incentivized for costs to go up. They have network contracts across the country where you're not getting the best deal. Give everybody a credit card and say, go buy healthcare with my money.
Well, thank you. Thank you. Anything else before we close here? Anything else we want to cover?
I just want to go back to what we said a little earlier, which is the first thing an employer should do is define why they're buying healthcare in the first place. Set their definition of what they want. Go out there and survey, monitor to see if they're getting it. And then, for goodness sakes, align your internal HR benefits department so their incentives are based on those surveys seeing improvements. And do the very same thing with the broker who's representing you to the healthcare system. Make sure that they're aligned with your goals as a company so that the more you reach what you want, they do better. That is one of the biggest fumbles in all of healthcare is employers don't know they can do that. And they can. You can sign a fee-based contract with a broker, and you can put in that fee-based contract with that consultant that part of their compensation is going to be not getting commissions, but getting paid directly from the employer. And there's incentives so that as my loyalty scores go up, they get to make more money. That one little step that an employer can make and play and do, like they do with every other part of their business, is one of the most important things they need to do in purchasing healthcare.
Thank you. And thank you for your attendance today. Thank you, Bob, for being here. For those of you who would like to know more, I'm going to share a screen and show you an image of Daryl's book. Here we go. This is Make Healthcare Work For You. When I first learned about this concept, I naturally knew it was a good idea, but it wasn't until I read the book that I understood the how-to. So I encourage you to get the book. It's available on Audible as well, and make the change that's necessary to help our economy. My God, and also the people. I work with team building a lot, and I'll say this: morale is not at its absolutely best right now with the global economic insecurity, the after effects of COVID, some of which produce changes that are not going back to quote unquote normal, and the conflict over hybrid culture. All of that has had the business culture really upset. There's a new article by Mark Scullard, which I'll attach in the text below, from Wiley Publishing, the publishers of the famous DiSC profile, on the problems with culture right now. So to conclude, if you want to get a hold of Daryl, what's the best way to contact you?
You know, my overall company is called Orriant, Orriant. And one of our wholly owned subsidiaries is Premier Alignment, which is where Bob's referring to. And we consult with companies through Premier Alignment on how to implement an aspirational model of healthcare for their employees. So easiest way to get a hold of us is go to orriant.com, ORRIANT.com.
Thank you.
Thank you.